Hello everyone, and welcome to the first video on our channel. In today's video, we'll walk you through the process of IV cannulation step by step, in a simple and easy to understand way. Whether you're new to this or looking to brush up your skills, this guide is for you. Without further ado, let's jump straight into the steps. Step 01. Introduce yourself to the patient and clarify the patient's identity. Explain the procedure to the patient and gain informed consent to continue. Inform that cannulation may cause some discomfort but that it will be short-lived. Step 02. Ensure that you have all of your equipment ready as follows: alcohol cleanser, gloves, an alcohol wipe, a disposable tourniquet, an IV cannula, a suitable plaster, a syringe, saline, a clinical waste bin. Step 03. Sanitize your hands using alcohol cleanser. Step 04. Position the arm so that it is comfortable for the patient and identify a vein. Step 05. Apply the tourniquet and recheck the vein. Step 06. Put on your gloves, clean the patient's skin with the alcohol wipe and let it dry. Step 07. Remove the cannula from its packaging and remove the needle cover, ensuring not to touch the needle. Step 08. Stretch the skin distally and inform the patient that they should expect a sharp scratch. Step 09. Insert the needle, bevel upwards at about 30 degrees. Advance the needle until a flashback of blood is seen in the hub at the back of the cannula. Step 10. Flashback of blood is seen in the hub. Step 11. Advance the rest of the cannula into the vein. Once the flashback of blood is seen, progress the entire cannula a further 2 mm, then fix the needle, advancing the rest of the cannula into the vein. Step 12. Release the tourniquet, apply pressure to the vein at the tip of the cannula and remove the needle fully. Remove the cap from the needle and put this on the end of the cannula. Step 13. Apply the dressing to the cannula to fix it in place and ensure that the date sticker has been completed and applied. Step 14. Check that the use-by date on the saline has not passed. If the date is okay, fill the syringe with saline and flush it through the cannula to check for patency. If there is any resistance, or if it causes any pain, or you notice any localized tissue swelling, immediately stop flushing, remove the cannula and start again. Dispose of your gloves and equipment in the clinical waste bin, ensure the patient is comfortable and thank them. And that's it. You've just learned the basics of IV cannulation, quick and simple. If you found this helpful, don't forget to like, share, and most importantly, subscribe. This is just the beginning. Amazing content is on the way, so stay tuned.